I'm Olga Avalon. I suffer from fibroids, anemia, and heavy bleeding. Start like 5 years ago with that problem. Start little by little. My periods were for 10 to 15 days. My activities start changing. I stopped doing the things that I love to do. Then I had to stop going to the beach, that I love it, to the pool, something that I love it.
I'm Dr. Samuel Kaufman. I'm a top-line MD doctor. I practice OBGYN at Women's Health Partners in Boca Raton, Florida. Olga has been a patient of mine for many, many years. She faced ongoing problems from heavy bleeding that occurred from a very common problem in women, which is a fibroid uterus. I would say that about half of women who get into their 40s will have uterine fibroids, and that's a pretty common statistic, and had gotten to the point where she needed iron infusions and other types of treatments to try and stop the bleeding. The bleeding did not stop, and surgery was really the thing that she needed.
But I never have a surgery. I'm so scared of surgeries. Dr. Kaufman explained me what we're going to do. He said the incision will be very little, that I don't have scarring, that I don't have to stay at the hospital for a long time. So, okay, we decided to do it.
Olga needed a form of hysterectomy. There are many types of hysterectomies now. This particular type that we were able to do for her is called a laparoscopic supracervical, above the cervix, hysterectomy. We also did it with our newer technique called a SILS, S-I-L-S technique. A small incision is made in the navel, and through that incision is passed a medical device that stretches the incision temporarily for the surgery, and then when you take it out, the incision gets smaller, and it leaves a very small scar. These are the fallopian tubes and the ovaries that are hidden from the enlargement of the uterus. This large space in this picture shows where the uterus was, and this is the area that was cut. The majority are done as outpatients. They can go home on the same day. After that, they usually spend about a week recovering at home, come to see the doctor in the office, and by the end of the second week, they're almost fully functional.
Since then, my life changed 100%. I start going to the beach again. I start working again full time. I'm super happy. I'm doing my exercises that I stopped doing because I gained weight, because I don't go to the gym anymore. Now I'm in the gym again. I'm doing every single thing like I'm 20 again. I feel brand new.
In this case, and in many now, we've changed what this procedure, hysterectomy, is to limit it to focusing on the problem, which is the uterine bleeding, without affecting things such as hormones and sexuality. So in reality, what happens is patients go from being either in pain, unable to exercise, unable to have intercourse, unable to go to work because they're bleeding too heavy, to a totally normal existence minus their menstrual flow.
If I know how easy, how good do I feel, and how I got my life back, I will do it 5 years ago.